ನನ್ನ ಹೆಸರು N Chandra Shekar, ಬೆಂಗಳೂರು ಕೋಣಂಕುಂಟೆಯಿಂದ ಬಂದಿದ್ದೀನಿ. ನನಗೆ 3-4 ವರ್ಷದಿಂದ ಮಂಡಿ ನೋವು ಇತ್ತು. ಅದು ಎಲ್ಲೆಲ್ಲ ತೋರಿಸಿದಾಗ ಬರೀ ಇಂಜೆಕ್ಷನ್ ಕೊಟ್ಟು ಇದು ಮಾಡಿದ್ರು, ಟೆಂಪರಲಿ ರಿಲೀಫ್ ಮಾಡಿತ್ತು. ಈಗ ಇಲ್ಲಿ ನನ್ನ ಮಗ ಇಲ್ಲೇ ಡಾಕ್ಟರ್ ಆಗಿದ್ದರಿಂದ ವಿನಯನವರು ಇಲ್ಲಿ ಅವ್ರ ಫ್ರೆಂಡ್ BN ಪ್ರಶಾಂತ್ ಅನ್ನೋರನ್ನ ಆರ್ಥೋಪೆಡಿಷನ್ ಅವ್ರನ್ನ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿದರು. ರೋಬೋಟ್ ಸರ್ಜರಿ ಮಾಡಿದ್ರಿಂದ ನನಗೆ ಪೇಯ್ನು ಆದಷ್ಟು ಕಡಿಮೆ ಆಗಿದೆ. ಈಗ ಮೊನ್ನೆ ಆಪ್ರೇಷನ್ ಮಾಡಿದರೆ ಕ್ಲೀನಾಗಿ ನಂದು ನಡೀತಾ ಇದ್ದೀನಿ, ಚೆನ್ನಾಗಾಗಿದೆ, ಹೆಲ್ತ್ ಇದಾಗಿದೆ.
Hi, I am Dr. Vinay Chandrashekar. So my dad, who was suffering from osteoarthritis of knee, right side knee, he was having very severe pain for the last 3 to 4 years. Managed initially with the local intralesional injection, but however he had a very severe pain, plus he had developed advanced stage of the disease where he had severe deformity of his leg. So I consulted my colleague Dr. Prashanth B N, who is a close friend of mine and is an exceptionally skillful orthopedic surgeon. He did a robotic-assisted right knee replacement for my father. He had a very smooth recovery in the post-operative period. He was started to walk from the very next day of the procedure, and he is quite happy. My father is now able to walk without any pain. So I am very grateful for Department of Orthopaedics, Narayana Health.
This patient has complaints of pain in the knee. When we evaluated, he had a varus deformity of both the knee, but his significant complaint was mostly on the right side. So it is more important to treat the patient than the X-ray or his reports. So patient does not have any complaints on the left knee, but definitely it is likely varus. X-ray shows a grade 2 or grade 3 OA, but the symptomatic was on the right side. So we did a robotic assisted knee replacement surgery for his right knee. So the advantage of robotic surgery is the amount of soft tissue dissection is less, and your balancing of the soft tissue is very good. So the patient usually are very comfortable. The amount of pain is very less. In that way, their rehabilitation is faster, their getting back to normal activity is faster. So that way robotic surgery is much more advantage compared to our conventional surgery techniques.